No, I'm not even putting the applause thing. We're just gonna start talking. Be fair to me. Be fair to me. I'm only human. Be fair to me. Hello, welcome to Zambia What a Day. Thank you so much for joining me on the podcast today. My name is Dingindaba Jonah Buyoya. Very delighted that you're joining me today. You've been with me for quite a while now, and I'm very grateful that you always join us taking a look at what's making news and what's making news in our country. There's a number of stories that we're going to have a look at. I'm just going to quickly run through what you should look forward to. One story is of a child who was declared dead but was not dead and then died for real. That was in Mazabuka. We'll talk about the private sector, which is facing collapse as NHIMA has failed to pay hundreds of millions in outstanding claims. And then we have the Lungu family, which is taking an urgent appeal to the South African Constitutional Court over the state funeral order. Let's get into detail into these stories. Let's start with a story from Mazabuka, where a family took their 17-year-old girl to the hospital. She had twins in her womb, and she delivered the first one at home, and the child died from home. Then the second one was delivered from the hospital. These were premature babies, and they were about 5 months. And when they were born, 23 weeks, and when they were born, one of them died from home when it was born from home, and then the one that went to the hospital was born and was below 300 grams. According to the medical personnel, their requirement is for a child to be born above 300 grams for them to be safe, to consider their livelihood and the possibility of them surviving even on incubators and other equipment that may be needed. But unfortunately, the child weighed below. So the doctor declared the child dead. And then the child was taken to the mortuary. But the medical staff at the mortuary said the child is not dead and sent the child back to the ward. So the family was livid over this, that a child had been declared dead, a child who was not dead. And so they spoke to Diamond Media, and the hospital has spoken out on this. The hospital is also now blaming, well, not the hospital, the provincial medical office is blaming the hospital for this mishap, and it's just very, very sad. It's very, very terrible, this whole thing. Helga did the story. Let's take a look at this.
In a tragic update, the second born of the twins born at Mazabuka General Hospital, previously mispronounced dead by the hospital staff, has also passed away. The family, already mourning the burial of the first baby just yesterday, has been left devastated by the latest loss. One of the family members alleges negligence on the part of the hospital, particularly on how both babies were incorrectly declared dead by the nurse on duty shortly after delivery.
Nebantu baleza kuboneka mwana oyu buumi bwalipo inompeyo yakamunjira kambo watumbu wa 555 so kuti aboneke kuti mwana ulayoya twaho omubona kuma 10 nintwari utola kuti tuyobole kokumujola munzira tibabike mu malaiti kwina chakahungidwe wahungidwe bokalapukeni kaubawa konse kumaulu akalanze so kuboneka buumi bwakaliko inompeyo yakamunjira 6 hours injakakedebo.
Confirming the incident, Provincial Health Director Dr. Kalistas Kayunga admitted there was negligence in how the situation was handled.
What is coming out is Iliada Tiagasika 10. Okay. You are actually around 5 to 6 months. Scan said 23 weeks, which is less than 6 months. So I think it was a miscarriage. Okay. One already 300 grams, or 400 grams, which is very small. So I think the mistake the nurse made was normally Those things, when they come out and they see that they're a bit viable, you keep them for some time. So that is the feedback I've gotten, but I'm awaiting the official report that it have demanded for it. But it was a twin pregnancy. But I think the mistake was they should have explained to the family very well instead of doing things without explaining to the family. Because normally when I want to baby, even a full-term baby, we don't rush into certifying. We keep them. Party is easy for you to certify. But even if I want to, we always encourage people to keep the body. Then you go in the gym, then you try to check again. That's when you can comfortably say, okay, mana was in Ulika.
The baby has since been laid to rest next to the other one who was buried yesterday. Helga Chibwe, Damo News, Mazabuka district in Southern Province.
So, Mabiza Resources Limited has disclosed severe operational challenges that have forced suspension of activities, some of their mining activities. There's close to 900 workers who have gone over 2 months without salaries. Mine officials have confirmed that the shareholders, UK-based CE Mining and CTG Jingtong of China, have failed to provide the promised funding by the 31st of July 2025, and a key contractor, Epiroc, has withdrawn its equipment over unpaid debts, and this has crippled the underground production and reducing operational flexibility. So the company has since requested emergency funding, but major contractors that include Zesco and several suppliers have been affected, and this has led to the plant basically shutting down. Let's take a look at this.
Southern Province Minister Credo Nanjua this morning visited Mabiza Nickel Mine in Mazabuka district of Southern Province to better understand the reasons behind its recent closure. During the visit, union representatives highlighted numerous challenges now facing affected workers.
The position that we are seeking as the union, the members, they want to know when are we going to get paid? Secondly, when is the mine going to start the operations? It is now when we have just heard that other stakeholders have been told that by the 1st of September, but as the union, that information has not yet been communicated to us.
Mazabuka District Commissioner also expressed concern over the situation, stating that many employees have been left stranded.
Some of them are almost being evicted from their homes because they are not able to pay rent. Salaries are not there. And apparently, we have information that on Thursday, Honorable Minister, we had some, I'm sure it's worth mentioning, that we had some bailiffs who came. That was for the second time.
Yes.
I'm sure all those details, Honorable Minister, in their submission, they will be able to.
Suppliers' debt is just getting bigger and we can't service that. And what happened, we started running out of consumables, underground explosives, plants, chemicals. So that was the situation that led now on 18th June to suspend operations. So all the equipment underground, from loaders, trucks, drilling machines, all come from Epiroc. The lithium, cobalt, these battery metals prices, we don't know, for some reason they've been going down because of the Indonesian market. The Indonesian nickel market, the Chinese have bought that and they're producing it at a very low price.
So we take it that 1st September, operations resumes?
That's the assumption made in those letters, sir.
And Minister Nanjua acknowledged the gravity of the situation and committed to finding a way forward for the workers and the mine.
What is the way forward? But what is the challenge is, could be that those who are running the mine are failing because they don't have money. That's what we are beginning to establish, that it's an issue of finance to materialize. That's why, as provincial administration now, we are concerned and we want to hear more, especially when your superiors are back.
Approximately 470 permanent workers and 350 contract workers have been affected. The mine reportedly shut down due to a drop in nickel prices, the withdrawal of equipment by the main contractor, and overall financial constraints. The minister has since rescheduled a conclusive meeting to next week, where possible solutions are expected to be discussed. Helga Chibwe, Damo News, Mazabuka district in Southern Province.
Now, in another story, the Healthcare Federation of Zambia has disclosed that the National Health Insurance Management Authority owes the private sector hundreds of millions of kwachas for various services provided to the public. HFZ President Dr. Shaileni Desai says the private sector is on the verge of collapse. And this is due to non-payment of claims, some dating as far back as 2024. Dr. Desai added that during engagement efforts, they were informed that NHIMA prioritizes payments to the public sector and whatever remains is allocated to the private sector. So he further stated that while private providers are not being paid, they're still expected to meet all tax obligations, which he describes as unfair. Let's take a look at this.
What began as a well-intended program to improve access to quality healthcare for all Zambians is now facing serious challenges. The National Health Insurance Management Authority, NHIMA, was established to bridge the gap between public healthcare needs and service delivery, and in many ways, it has done just that. But today, that vision is under strain. The Healthcare Federation of Zambia has raised alarm bells revealing that NHIMA owes the private health sector hundreds of millions of kwacha for services already rendered to the public. Some of these unpaid claims reportedly date as far back as 2024.
That obviously brings a lot of problems to the private healthcare providers. First and foremost, let's look at the statutory obligations that each business must make. We have to pay NAPSA, we have to pay the ZRA for various taxes. They are not waiting for us to say, look, we have not yet been paid, can we clear this as we get paid? We have to pay on time. That alone has put a lot of stress on private healthcare providers. If we don't pay, like any other business, we are charged, we are fined. And those fines, again, just increase the bills that we need to clear. To service each and every client that comes through a facility, even if it's just a dental clinic or a pharmacy itself, we require stocks. That the private sector is literally on its knees at present because of all these issues.
To make matters worse, private providers have faced accusations of overbilling, claims the Federation strongly denies, calling them both unfair and unfounded. Dr. Desai further noted that NHIMA reportedly prioritizes the public sector in its payments, only dispersing leftover funds to private institutions, a system the Federation says is unsustainable and unjust. The Federation is now calling on President Hakainde Hichilema to urgently intervene.
As a Federation, we make an earnest appeal to His Excellency the President of this country that this is a dire situation, and we request that he takes care and looks at what is going on seriously. We are ready as a federation to come and explain to him in detail and his team what is happening. We are requesting that our payments are made in a timely manner so that we can continue to provide the services that we do. We wish that this tariff structure can be looked at so that it is cost reflective for business. We also request there is equal treatment of both private and public sector healthcare providers. Finally, we want consultation on everything that affects us.
NHIMA is yet to respond to the concerns raised. As the nation looks to build a resilient health system, the call is clear: transparency, fairness, and timely support must be at the heart of it. Victoria Kayeye Yambani, Diamond News.
Finally, Opposition Patriotic Front Secretary General Raphael Nakacinda has been found with a case to answer by the Lusaka Magistrate Court, and this is in the matter relating to alleged hate speech against the people of Wengwa. The prosecution has alleged that in 2023, Mr. Nakacinda made remarks that ridiculed and showed contempt for the Tonga-speaking people of Wengwa in Southern Province, criticizing voters for electing a person from the area to State House. Let's take a look at this.
The Opposition Patriotic Front faction Secretary General Raphael Nakacinda has now been placed on defense by the Lusaka Magistrate Court over alleged hate speech remarks he pleaded not guilty to against the people of Wengwa. The prosecution in this matter alleges that Mr. Nakacinda's comments made in May 2023 showed hatred, ridicule, or contempt toward the Tonga-speaking people from Wengwa in Southern Province on account of their tribe and place of origin. The alleged utterances criticized voters for electing a person from Wengwa to State House. When the matter came up before Magistrate Ida Piri, the court ruled that the accused has been found with a case to answer, stating that the testimony presented by prosecution witnesses on the record is sufficient to require Mr. Nakacinda to open his defense. Magistrate Piri has since set September 19, 2025 as the date for Mr. Nakacinda to open his defense and present evidence in his favor. In another matter, Nkana Member of Parliament Binwo Mpundu has appeared before the Lusaka Magistrate Court in a matter he is charged with the offense of seditious practices. The state in this matter alleges that the accused on December 29, 2024 in Lusaka urged his fellow politicians to buy guns in readiness to defend themselves, remarks said to incite violence or any offense prejudicial to public order or likely to disturb the public peace. When the matter came up before court, Chief Resident Magistrate Davis Chiwili allocated the matter to Court 9 before Magistrate Webster Milombe, where the charge was explained. The court read the charge, but there was no consent to take plea yet from the Director of Public Prosecutions, DPP. Among notable political figures present to offer solidarity were Kafisa Member of Parliament Christopher Kangombe and Peer Secretary General Raphael Nakacinda, who addressed the press later.
The job we have is to continue advocating for unity among all political players in the opposition, but also the main opposition political party, Patriotic Front. We want to continue to quietly mobilize and make sure that we are united and a strong force that will be able to wage a decent and meaningful political contest in 2020.
Best Jerry, reporting for Diamond News.
There's somebody behind bars for this, and that is Chimakambwidi. And you know, his videos have resurfaced since he's been unwell. His daughter made an appeal, sort of to the president, an open letter to the president, and just talking about this same situation and asking that he be released because he's been unwell, and compassionately speaking out to the head of state on this issue. One of the things for me that I've found very interesting, and I was thinking about this the other day, when Davis Chama was sent to jail for about 10 years, it's really the thin line, right, that exists between trampling on the rule of law and compassion. Because I was thinking to myself, if it's an ordinary citizen, would people have the same compassion? Like if it's just a random George who has committed a crime and has been sent to jail, is there even a single person that's going to come out and say the president should feel sorry for George?
I think if the story was known, it would be there. The difference is these people are in the public eye. So you can see everything that they're going through, right? But an ordinary George, there's not much that people know about me. So I can be going through the most and my family won't know where to turn to. I think as a people, we're very compassionate.
What do you think about the situation? No, say.
What I think about the Chishimba situation. I think if his situation is very critical, I don't think somebody should be sick, that sick, and in prison, to be honest. It's could be something where they suspend his sentence and let him recover, then take him back as soon as he's fully well. Because if he dies while he's in custody, then what happens? It's like putting his blood on the system's hands. Because if they can't handle his situation, then why are they keeping him there? It's like keeping you at a district hospital when you need to go to a general hospital.
I'm just listening to you, bro.
You're just listening to me.
I
think you should. I was actually looking forward to your comment on NHIMA, though.
On NHIMA?
Yeah. I honestly.
What did you want me to say? What did you want to hear about me and NHIMA?
Very sad situation that government expects people to be compliant and they don't want to be compliant.
I think it's a two-way thing. A lot of people are not compliant with NHIMA, by the way. A lot of organizations are not compliant with NHIMA. But aside from that, I find it very, very ironic that the private sector are coming out to say this, because I think they've also been incredibly unfair on the government. They have been incredibly unfair on the people. NHIMA is a public insurance scheme, and they have not been upholding their morality as well, because private clinics are so expensive and they exaggerate the costs of things. Now, I can understand when private citizens are going there to buy these things, but when this is being funded using public resources, they need to have a moral compass. To charge tenfold the amount of money for these IV fluids. It's insane what these private companies are doing, these private clinics. And you know that's the truth, that they charge exorbitant amounts of money. So that's the money that NHIMA needs to pay. But also, NHIMA has been limping. NHIMA has been limping, and that's just the truth. I don't know where the money is going, but NHIMA is in a shambles. It's a brilliant initiative that's just not working. It's not working. Even people, when you go to the hospitals, let's talk about these same private hospitals. Let's be honest, how they treat NHIMA patients. You go, if you are on NHIMA, just forget it. If you're on NHIMA, you go to the hospital in the morning. That's why I would never use my NHIMA. Because imagine being a sick person. You are sick. You go to a private clinic. A private clinic, which we all believe a private hospital is supposed to have better service and it's supposed to be quicker. People go to private hospitals. If they're on NHIMA, they follow a long queue. There's a special queue for NHIMA, actually. Yes, there's a special queue. These people are NHIMA people. And they will be going through that queue. I've been to the hospital before. And there's a queue for people that are paying cash. That service by those people is going to be paid nonetheless. It's been delayed, yes, but it's going to be paid nonetheless. So I think NHIMA is a great idea that is also such a pain. Imagine you are sick and you're not going to be a priority because you're on NHIMA. But you see, that's a two-way thing, isn't it? The hospital prioritizes the paying client because NHIMA itself delays when it comes to paying these hospitals. But I think NHIMA still is a brilliant idea for a country like Zambia that is struggling. But we need to plug in the loopholes.
But still, then why were they accredited to then control NHIMA system in the first place? Because you know that the services are so expensive. So why did NHIMA say we can't afford these services?
I should answer for NHIMA.
I'm just saying.
Be fair. Be fair to me. Be fair to me.
Things that should have come up in those meetings.
Be fair to me.
I'm just being honest.
I'm only human. Be fair to me.
Cost of inefficiency.
Yes, the cost of inefficiency is very high, but be fair to me. No. I'm done. Thank you, colleagues. Bye-bye.